What are the risks of subclinical hypothyroidism in pregnancy? Imagine a tiny imbalance in your thyroid that might seem minor but could have important effects during pregnancy. Subclinical hypothyroidism is when your thyroid-stimulating hormone levels are a bit high, but your thyroid hormones stay normal. It's often called a mild form of thyroid underactivity. While it might not cause obvious symptoms, it can still influence pregnancy outcomes. Research shows that women with subclinical hypothyroidism may face a slightly higher risk of miscarriage compared to women with normal thyroid function. This risk seems more pronounced if they also have thyroid peroxidase antibodies, which are markers of autoimmune thyroid disease. Some studies suggest that these women might also be more likely to deliver prematurely, before 34 weeks of pregnancy. Preterm birth can lead to health challenges for the baby, including breathing and feeding difficulties. There is also some evidence that subclinical hypothyroidism could increase the chance of placental problems, like placental abruption, where the placenta detaches early from the uterus. This can be dangerous for both mother and baby. Additionally, women with this condition might have a higher likelihood of developing high blood pressure disorders during pregnancy, such as gestational hypertension or preeclampsia. These conditions can increase risks for both mother and child, if not managed properly. Babies born to mothers with subclinical hypothyroidism may be smaller than average or experience growth restrictions inside the womb. Some research indicates that these infants might need neonatal intensive care or face respiratory issues after birth. There is also ongoing discussion about whether untreated subclinical hypothyroidism could impact the baby's brain development, possibly leading to cognitive delays later on. It's important to note that not all studies agree on these risks. Some large studies have found no significant link between subclinical hypothyroidism and adverse pregnancy outcomes. Differences in how studies are conducted, the populations studied, and whether thyroid antibodies are present can influence results. For women with risk factors like a history of thyroid disease, autoimmune conditions, previous pregnancy issues, or positive thyroid antibodies, healthcare providers usually recommend close monitoring. Many guidelines suggest screening for thyroid function during pregnancy and treating with levothyroxine if necessary. This treatment can help reduce the chance of complications, especially if TSH levels are above the recommended range for pregnancy or if thyroid antibodies are positive. In summary, subclinical hypothyroidism in pregnancy may carry risks such as miscarriage, early birth, placental problems, high blood pressure disorders, and neonatal health issues. However, the evidence varies, and personalized care from healthcare professionals is key. Regular checkups and appropriate management can help improve outcomes for both mother and baby. Always consult your doctor for tailored advice and support throughout your pregnancy journey.